Hi, I'm Vera Arceo. I'm retired, 64 years old, but still active as a marketing consultant. 2 weeks ago, I was here and I underwent thread lift on my face, the upper third portion. And as you can see, in 2 weeks' time, the results are pretty visible. I didn't wear makeup today, nothing on my face except for moisturizer and sunblock. And I did it intentionally so that I can show the results of the procedure that was done 2 weeks ago. So here I am. Probably Dr. Alapag will make some enhancement on my nose to make it more distinctive so that it will blend with the overall look of my rejuvenated facial skin. Don't forget to click the subscribe button and the notification bell to keep you posted.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a follow-up. Let's all welcome back Ma'am Vera Arceo.
Hello, good afternoon, Doctora. Good afternoon, everyone.
Yes. Okay, so Ma'am Vera had a non-surgical face thread lifting. So we did the upper third about 2 weeks ago. And looking at Ma'am Vera right now, so there's already an improved forehead section, also a better eyebrow position and upper eyelid. There's also a lifting, and on the corner of the eyes, there's also a lifting. And the infraorbital section, we also noticed like skin tightening and firming already. And it's just 2 weeks, Ma'am Vera.
Yes, 2 weeks.
We will still expect results. Like about 12 weeks time, there's the so-called neocollagenesis, neovascularizations, improvement of the skin's elasticity as well as the volume, because we also had used volumizing threads apart from those threads with lifting benefit and also collagen synthesis also for volumizing. Yay! Right? So for today, we wanted another procedure for Ma'am Vera, and that is enhancing the center of the face, our nose. Okay? So, Ma'am Vera is 64 years old because actually she was mentioning to me that, Doctora, is it still okay for a 64-year-old to undergo a non-surgical thread lifting for the nose? Okay, so today we will be doing that kind of procedure for her. So, there's no contraindication to do the thread lifting on the nose, right? Yan. And looking at Ma'am Vera, okay, so for the dorsum of the nose here, we wanted to improve the height and we wanted to also somehow make the nasofrontal angle like near the 130 degrees angle. And then for the tip region, since Asian nose, we have a rounded nose tip, we wanted to somehow narrow it. And also the alar region, we wanted to also somehow reduce the width of the alars, or the so-called the intercanthal width, okay? And improve that nasolabial angle too, okay? So, Ma'am Vera, are you excited?
I'm ready.
Yeah.
We'll find out later.
Yeah. Okay, so what kind of technique, what product material are we going to use for the non-surgical nose thread lifting for Ma'am Vera? We'll show you when CSA Medical Aesthetics returns. So we're now going to do a so-called non-surgical nose thread lifting for Ma'am Vera. Okay, in our assessment, if you check on the dorsum of the nose, so you can see that there's like a height that is not the one that is meeting the right height of the nose. Okay, and if you go at the nasal tip region, So we noticed that it's somehow rounded, and if you check on the so-called intercanthal distance, so it's still wider. So Ma'am Vera, our goal is to somehow lift this dorsum, project it, and also upturn the tip and give that narrowing effect. Right, Ma'am Vera?
Yes.
Okay. And then in doing non-surgical nose thread lifting, we needed so-called cleansing of the area and then numbing of the area. Okay, so a while ago I did multiple injections of our lidocaine. Okay, and I can further add injection on the entry point. In terms of assessing which will be our entry point, we have a measurement like about from the tip defining point, you can measure like 5 millimeter up to the infratip region. So our entry point will be infratip area. And then for the dorsum of the nose, we'll be using PDO threads with a length of about 60 millimeters. And then for the columella, we'll use those PDO threads with a length of 40 millimeters. So again, the goal is to increase the height as well as improve the projection of the nasal tip. Okay, so let's start. Are you ready, Ma'am Vera? Okay, so that's for our assessment as well as the discussion on the technique and the material that we will be using, our PDO YCO threads. Okay, so our entry point is the so-called infratip region here. So 0.5 centimeter from the tip defining point. Okay, so we're so careful in doing injections. Last time, Ma'am Vera, if you remember, when we were doing like puncturing, there's some bleeding there, but right now it's less. Okay, so entry point is here, infratip area, and I am using here a YCO 60 millimeter for the dorsum projection. So just the tip of the cannula here, bevel down and grasp the nose tip and glide. So we are staying in the midline section on top of the bone and cartilage, or supraperiosteum and suprachondrial layer. Okay, so that's one. For some cases, we add dermal fillers. Okay, for Ma'am Vera, she already has a good volume of the nose, so we'll just use our PDO threads. Okay, so some gliding up to the radix. Okay, so for some areas with some resistance, I think Ma'am Vera has a history already of doing thread injections, so you'll feel some resistance already. Okay, so some resistance in the radix. Okay, and then I'll pull out. So this kind of thread, YCO, is a cog type of thread, meaning to say it has those barbs on the strand of the thread, so it can have a stronger hold or grasp in the inside nose tissue. Okay, and then pull out. So a little bit of like twisting there to make sure that the thread is left inside, and also grasping here so that when you pull out the cannula, the thread will really stay inside the tissues. Okay, so you have to reach the radix part, grasp here and pull out so that the thread is left inside. So I'll be using about 6 strands on the dorsum. Okay, and then so I really have to reach the radix. Some resistance because of a past history of an injection. Okay, and my final YCO. Okay, grasping and pushing up to the radix. There you go. So far so good, Ma'am Vera?
Yes.
Okay, so we're done with the 6th. Now let's do the tip columella projection. So actually for some cases, I use the same entry point, but for individuals with short columella, I prefer to have another entry point for the reason that we don't want this kind of thread to be going out in the entry point. Otherwise, the entry point will not close very well. So I can make another entry point here just for the columella projection. So for some cases, I use the same entry point depending on the columella length. So I'll grasp the columella and I'll insert in the so-called intercrural space. So my technique is a little bit of a twisting there, just to make sure that I glide it within that space, because there's some like fibrous structure that we need to release. So I glide a little bit and twist a little bit. Okay, so we're about finishing. Okay, and that's it. So we'll show the result to Ma'am Vera when CSA Medical Aesthetics return. And we're back, so let's now show the result to Ma'am Vera. Ma'am Vera, here's the mirror. So we've done an instant nose lift. We use those PDO Wyco threads for the dorsum augmentation and the tip columella projection. So how was it, Ma'am Vera?
And I thought I had a nose.
Yeah.
It's incredible.
Right.
Kidding aside. Very, very, very obvious. Thank
Exactly.
you.
An instant result.
Yeah.
So far, how was the experience when we were inserting those threads?
Well, like I was always saying, this procedure is almost painless.
Yep.
There's some sensation, but it's very, very well tolerable.
Yes.
And I didn't even notice that we're done, actually. It was so quick. Like less than 10 minutes, perhaps?
Yep. Right. Yeah. So looking at Vera right now, if we do an assessment, okay, we have already improved the dorsum height and also create that curvilinear nose line effect, a better contour, a better shape, and the tip is less rounded, and we were able to make the alars narrower. So with the tip columella projection, because you're projecting it anteriorly, somehow you're decreasing the width of the alars of the nose. And it's a technique that's very quick, right? It was a quick procedure, and we did a safe technique. We inserted in the right anatomical layer. We use those products that are, of course, clinically proven safe. And the good thing with the Wyco is because of its cog on the strands of the threads, they're able to like grasp the inner tissues of the nose. They really have that strong binding inside the tissues of the nose. And the good thing with these PDO threads, they stimulate neocollagenesis and neovascularization. So as time passes by, you will see tissue buildup. These are fibrous proteins that will form inside the tissues of the nose because of these PDO threads. So it's not only like having them inside and they're absorbed after some time, but they will have an effect of tissue buildup. Okay. That's why these kinds of threads, we call them tissue regeneration threads. So they will restore the natural volume, they will build again collagen, elastin, and somehow improve, specifically with this procedure, the nose contour, the nose shape, the nose height, the nose projection, and is an instant result, right?
Thank
I
you.
could say there's no downtime for this one. So Ma'am Vera could still go back to work or still have another activity after these, or have a meeting, or do a virtual conference. And then we'll just advise Ma'am Vera, of course, we have some prophylaxis antibacterial and some analgesics. Do cold compress after this, and do not sleep on your nose tonight. Okay. Bawal ang nakadapa. It's just a joke. Okay, I'm making Ma'am Vera happy. Okay. So you deserve this, Ma'am Vera. Because some people are asking, I'm already 60 something or even late 60s, can I still do a non-surgical nose lifting? And so Ma'am Vera here had tried it, and she can really share with you that it's safe, it's okay, plus it's non-surgical, although it's minimally invasive. But of course, the products that we use are clinically proven safe. Okay, there you go.
Yes, thank you very much.
Yeah, any message to them?
Oh yes, this is about feeling good of yourself, and I never realized that such procedure using thread can really make an immediate difference
Yes.
in the rejuvenation of your face, of the skin, and so on and so forth. And well, we'll have more of the saga of a 64-year-old lady.
Okay, if you have any questions, you may email us at csaskinclinic@yahoo.com. We have our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact number 0933-860-9193 or 0917-504-4268. And the other episodes where we highlighted Ma'am Vera's procedures, you can see them at our YouTube channel. Just type Contessa Salvador Alapag. So thank you so much. Thank you, Ma'am Vera.
Thank you very much.
God bless.
And see you again.
Yes, God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.